Thank you, chairpersons. And I really appreciate the enthusiasm of the people who are present on the last day of this conference. In this brief discussion about information technology and gadgets in diabetes, what I am going to cover, half of my work has been done by previous speakers. Friends, I come from a background where I completed my 33 years of clinical practice. And then after I got engaged with this, since last 3 years in APICA and RSSDI, I have been promoting smartphone apps. And the smartphone apps and the technology has really revolutionized the whole concept. I greetings from this place. This is a glittering suburb called Kharghar from Navi Mumbai, the best developing suburb of Navi Mumbai. I don't have any disclosures, interests or supports. Nobody has supported me in these studies. This is all on my own. But I have been encouraged by people like you. I got a request for all of you, those who are taking the photographs. Don't take photographs. I am going to mail you the presentation. This presentation belongs to you. This is not my presentation. Because of people like you, I am making this presentation. So this is the encouragement. I appreciate the vision of organizers. And the flow of my presentation is likely to be this. What are the gadgets and apps which are built in any basic smartphone which you can use very easily? The job of glucose monitors has been made easy by devices, but I'm going to add something like fault detectors and hypoglycemia detectors. What are various add-ons, wearables, either over the wrist or over the cloths, or there are a lot of add-ons which are wearables, but they need to be attached to the skin for a remote sense vital monitoring, and the gadgets of a specification which can be attached to any internet-based instrument to assess end organs like eye, heart or brain. And a few lines about what is going to be the future of research and the technology. It is not the organizers or it is not me who is worried that the medical healthcare industry is not at all using the technology. But our Prime Minister also is worried that medical devices industry in India is definitely underinvested and underused. It has been endorsed by WHO. Friends, to ask very simple question, our poor diabetic patient needs only these 3 or 4 things. Easy glycemic monitoring, either invasive, non-invasive. He will be happy if you take out the pricks out of it. What is the adherence to the treatment and follow-up? Burke really nicely explained utility of Gather Health in increasing the follow-up. Maintaining and preserving medical records. Santosh is doing a wonderful job. Even be in place like Nanded, right from this day one, all the medical records are there. Can I detect some deteriorating conditions like falls, arrhythmias, autonomic neuropathy, silent myocardial ischemia, hypoglycemia, most dangerous, convulsions. And I'm not going to discuss the things which have been done by the previous speakers, mainly insulin pump. Why this topic on gadgets? Advantages, number 1, information at the point of care, cuts out all the complicated calculations and epidemiological things, improves communication at a moment. I used to work for a medical college. We have got a team of 50 people in our department. Once ECG flashed in our group, you get answer for conditions like torsades de pointis or ventricular fibrillation within 10 seconds. Clinical help at a crisis time. Access to the database, eco-friendly, low cost, no printing. And this is my biggest advantage. I take a chance to learn from juniors, children, and even my grandchildren. Technology has changed everything. Look around you. Are the things the same? Airline, you can show on the gate, you can show a smartphone. Medicine is the only branch which has not been benefited by technology. Do you remember which is the only product Google has failed? And that is Google Health. That is because doctors are not using it. There are a lot of hundreds of gadgets are available. What are the merits and demerits? And how they can help us is from the office practice, outpatients, in hospital, ICCU, for research, publication, and for the future. But as Debasis has pointed out some practical problems, I will add something to this. The fast changing subjects, models and add-ons. I asked my vendor, is this a latest model? He said that, doctor, I got a turn back guarantee. Because the moment you turn back, a new model has come. So don't ask me about a new model. Lack of a validating and controlling authority. Many standards are for the Caucasian populations. We need to adapt for our setting, and the cost, software setting, after the service and maintenance are some of the issues. How to buy and recommend a gadget? This is the series of C, created by whom, what is the CV, what is the center, what is the credibility, consumed by how many people, most important, not consumed, criticized by how many people. And you have to see what are the medical versus health applications, and don't buy from the grey market, buy from the dealers. Any medical setup, tug of war between experience and technology. The seniors are going to say, our experience is fantastic. I am going to say my technology is superior. Consider all aspects of healthcare, right from patient communication to building a body area network. All these 10 aspects of diabetic care requires definitely gadgets. So let us go one by one. I am going to talk about something really very simple. This is an instrument called as a cell scope, or a otoscope, or a remotoscope, or a skin scope. It can take a picture, high quality picture, you can send it to anybody, he will give an answer to you. There is an e-spatula, which is a 3-in-1 instrument. It takes temperature, good light, tongue depressor, you can diagnose all the upper respiratory things. This is a Kinsa smart thermometer, transmits data to the smartphone. This echo gives a stethoscope a new superpower. You can record actually the sound waves and see how the things are changing pre-operative, post-operative, or with the treatment. Smartphone scan for oral cancers, comorbid oral dental diseases. Dental diseases are very important in diabetics. You can detect a pre-cancerous condition, and this is an invention from an Indian person, Ved Prakash. And whenever I see all the gadgets, many gadgets are prepared and invented by Indian people. Imagine a patient with chest pain. You need to analyze the ECG, decide whether he requires, there is a STEMI or requires thrombolytic. A gadget like this looks a bit complicated, but it is very simple. It can attach the ECG, there can be a video conferencing, you can virtually see the patient, you can transmit the heart sounds, and you can decide whether you want to give a thrombolysis or not. The ECG can be transmitted like this. You can analyze it, you can enlarge it, you can see how is the ST segment, whether are there any arrhythmias. Glucometers and peripherals, IBG star, blood glucose monitoring was the first device. It uses a technology called as a dynamic electrochemistry. Forget about these complicated words. But what is most important for my patients, that do you have a punctureless glucose monitor? Yes, there are few punctureless glucose monitors, and they will transmit the blood sugar values to 5 caretakers in one go. There are a lot of glucose sensing devices. A glucometer which just puts a plug like a pulse oximeter, or sometimes can even detect a tattoo, will tell you what is the direct blood sugar. For the juniors, type 1 who are fearing the pricks, you can put the blood glucose meter on a Nintendo, it is called as a digit. Wireless glucose monitoring, thanks to Abbott for bringing out this technology. It is really a wonderful boon for our patients. These are the glucose tattoos and iSense. iSense includes a contact lens which is to be kept. It is used like a contact lens, and it senses the glucose figures to the remote monitor, which are just carrying like a mobile phone. Tubeless insulin pumps from My Life, Omnipod, some smart glucose watches, they are going to be helpful to you. Hypoglycemia, friends, is the deadliest barrier in glycemic control. This instrument, Hypoband, helps it. It has got a red button. It acts like a panic button where you can get 6 SMSs at one go. And it detects something called as a cold sweat, which is a common symptom, whether it is hypoglycemia or acute myocardial infarction or a GI bleeding. A serious condition can be detected very easily. A patient who is having epilepsy, can he sense whether he is having an impending episode? A device called as the iCalm or a smartwatch called Embrace, it detects the ED levels in the skin and it can predict an impending episode of epilepsy. The pens are becoming smarter. They remember what was the previous dose, what was the glucose value, and there is a BioDel glucagon device which can treat hypoglycemia by injecting glucagon by pre-programming. Compliance, biggest problem. All your dabbas in the patient's house will be replaced with things like this. The moment the patient takes a medicine, you will get a SMS or you can find it from his diary that whether the person has taken a tablet or not. Exercise promotion, biggest problem. With various electronic communicating gadgets which connect to either to a smartphone or a computer, these are the apps which you should remember: Runkeeper, Runtastic or a pedometer. You have got some wearable socks, headgears, they improve your compliance follow-up. How? This is the map outside my house and it tells me, the blue line tells that how much I have walked, how many calories I have spent, what is the duration, and it gives me a reminder and even encourages me that you have made a great record today, you must keep it on. Runkeeper, it is a very simple application, everybody should have. These are many wearable devices, there are many new things are coming up. This GoQ Life, 12,000 rupees, it doesn't belong to this Dr. Sriram Kulkarni, but it belongs to Dr. Sriram Madhuri Dixit. You are going to add 12,000 rupees every year, but it is as good as having a personal trainer for yourself. This is a watch, a health keeper. Cardiac arrhythmias can be detected by this Vitally Medical Monitor or NIMI bands. And this remote patient monitoring is not far from because the efforts of organizers like Geo. Our patients fall. Our patients are incontinent. Can you detect it? These are the patient alarm systems, home medical alarm or medical monitoring. This is a fall guard alarm with bed alarm sensor pad. If the patient is incontinent, you will get an alarm with this. Advanced products of glycation, very difficult to evaluate, but this machine will definitely help you to decide the advanced products of glycation. EHRs can be made interactive. A program by My Life Diabetes helps you for all these things. Want to do a retinal examination? $600 US, Well Salins Eye Examiner System. Eye Care by a program called as a PIC, Portable Eye Examination Kit. It is a mobile, low cost, easy to use, high quality. But is there something near to us? Yes, non-dilated fundus examination by Bosch. It can manage all non-cooperative patients like this, and the images are analyzed by the telemedicine experts who are going to send you all the reports. Your phone is lying, your patient is hypoglycemic, it doesn't know who is him and what suffers from. ICE, in case of emergency, is an app which should be there in every person's smartphone, and it will work even when the phone is locked. That is the beauty of it. This is an application called as a MOA, Mobile Wound Analyzer. It analyzes the ulcer in few minutes, percentage of ulcer tissue is there. It archives, prints and sends and analyzes the surface area of the ulcer, and you can assess the progress of the ulcer, how the things are going on. And these apps hardly cost around 120 to 150 rupees, but they are going to be really helpful to you. There are a lot many new innovations going on. This is called as IBM's Watson. It is the future of computing in which you are going to take off the language barrier between the patient and doctor. The patient can communicate without the language. So my urge is you please use your peripheral, rechargeable, expandable, portable, handheld gadget which is available in and around you. Friends, it is unending subject. There are lot many new things which are coming. And you must remember, it is not the machine, but the man behind the machine matters. So how you use these machines is very important for your patient, and your enthusiasm matters. I am really grateful to all the people who have helped me to be enthusiastic. These are my teachers. Practically everybody in this audience knows Dr. R.D. Lele, who has been writing volumes on computers in clinical medicine, and you can, those who are from Miraj and some part of South Maharashtra will not forget Dr. S.V. Soltur, who has been teacher and he is always an encouraging person for me. I really appreciate your patience. Please remember, before using any gadget, the clinician's role prevails. Technology changes, advances are welcome, but human touch, rational thinking, clinical acumen and empathy are totally non-technical, and they will always win. Combine them wisely. Think for the people of land, make India a diabetes care capital. These are few references, iMedical apps. Please remember these two words, Internet of the Things and a Journal of Mobile Medical Technology. You must try to look through this Google Glass. I don't want you to have an application something like this which is very complicated, but in case You have to learn, you learn from this modern crow and try to be smart, try to learn from everybody. If you have any questions, if you want to send me any queries, you are most welcome. This is my email ID and this is my mobile number. Thank you very much. Thanks for the time.